Here's a medical thing they don't tell you. Let's talk about some of the more uncommon causes of cancer, because we might have heard of things like eating processed foods, tobacco, alcohol, obesity being risk factors, but there are some other things that you might not be aware of. One in particular are genetic mutations that are passed down family lines. These are things like the BRCA mutation or the BRCA mutation, among other genetic mutations that you start to get suspicious when your mom had ovarian cancer and her mom had breast cancer and other BRCA-related cancers. That's a gene that could get passed down from generation to generation. Not always, but sometimes. And that could be a reason why someone has early cancer. Another one that's getting discussed more often, but is still not as prevalent, are infections that later on cause cancer. So this is something like HPV causing cancer either in the throat or in the cervical region or other regions in the body. This is something like H. pylori causing stomach cancer. These are things like hepatitis viruses causing liver cancer, and so on. And the good news is the more we can effectively diagnose and treat these infections, the better treatment we have at eventually preventing cancer from these. And again, the cancer doesn't happen often. It's very rare that these infections lead to later cancer, but it's still a risk factor. And the last is when you're exposed to industrial chemicals, whether it's you work in a lab or you're around benzene or you're around asbestos that could cause lung cancer. That's why it's so important to know where you work, what you're exposed to, and what to do if something happens later on the line where you find out that you have a particular cancer that could potentially be linked to what your employer used to have around.